Hi, welcome to JBPralay. Now we will know IVF. Well, in vitro fertilization, IVF, is a complex series of procedures used to help with fertility or prevent genetic problems and assist with the conception of a child. During IVF, mature eggs are collected, retrieved, from ovaries and fertilized by sperm in a lab. Then the fertilized egg, embryo, or eggs, embryos, are transferred to a uterus. One full cycle of IVF takes about 3 weeks. Sometimes these steps are split into different parts and the process can take longer. IVF is the most effective form of assisted reproductive technology. The procedure can be done using a couple's own eggs and sperm. Or IVF may involve eggs, sperm or embryos from a known or anonymous donor. In some cases, a gestational carrier, someone who is an embryo implanted in the uterus, might be used. Your chances of having a healthy baby using IVF depend on many factors, such as your age and the cause of infertility. In addition, IVF can be time-consuming, expensive and invasive. If more than one embryo is transferred to the uterus, IVF can result in a pregnancy with more than one fetus, multiple pregnancy. Your doctor can help you understand how IVF works, the potential risks and whether this method of treating infertility is right for you. Why it's done. In vitro fertilization, IVF, is a treatment for infertility or genetic problems. If IVF is performed to treat infertility, you and your partner might be able to try less invasive treatment options before attempting IVF, including fertility drugs to increase production of eggs or intrauterine insemination, a procedure in which sperm are placed directly in the uterus near the time of ovulation. Sometimes, IVF is offered as a primary treatment for infertility in women over age 40. IVF can also be done if you have certain health conditions. For example, IVF may be an option if you or your partner has fallopian tube damage or blockage. Fallopian tube damage or blockage makes it difficult for an egg to be fertilized or for an embryo to travel to the uterus. Ovulation disorders. If ovulation is infrequent or absent, fewer eggs are available for fertilization. Endometriosis. Endometriosis occurs when tissue similar to the lining of the uterus implants and grows outside of the uterus, often affecting the function of the ovaries, uterus and fallopian tubes. Uterine fibroids. Fibroids are benign tumors in the uterus. They are common in women in their 30s and 40s. Fibroids can interfere with implantation of the fertilized egg. Previous tubal sterilization or removal. Tubal ligation is a type of sterilization in which the fallopian tubes are cut or blocked to permanently prevent pregnancy. If you wish to conceive after tubal ligation, IVF may be an alternative to tubal ligation reversal surgery. Impaired sperm production or function. Below average sperm concentration, weak movement of sperm, poor mobility, or abnormalities in sperm size and shape can make it difficult for sperm to fertilize an egg. If semen abnormalities are found, a visit to an infertility specialist might be needed to see if there are correctable problems or underlying health concerns. Unexplained infertility. Unexplained infertility means no cause of infertility has been found despite evaluation for common causes. A genetic disorder. If you or your partner is at risk of passing on a genetic disorder to your child, you may be candidates for pre-implantation genetic testing, a procedure that involves IVF. After the eggs are harvested and fertilized, they're screened for certain genetic problems, although not all genetic problems can be found. Embryos that don't contain identified problems can be transferred to the uterus. Fertility preservation for cancer or other health conditions. If you're about to start cancer treatment, such as radiation or chemotherapy, that could harm your fertility, IVF for fertility preservation may be an option. Women can have eggs harvested from their ovaries and frozen in an unfertilized state for later use. Or the eggs can be fertilized and frozen as embryos for future use. Women who don't have a functional uterus or for whom pregnancy poses a serious health risk might choose IVF using another person to carry the pregnancy, gestational carrier. In this case, the woman's eggs are fertilized with sperm, but the resulting embryos are placed in the gestational carrier's uterus. Multiple births. IVF increases the risk of multiple births if more than one embryo is transferred to your uterus. A pregnancy with multiple fetuses carries a higher risk of early labor and low birth weight than pregnancy with a single fetus does. Premature delivery and low birth weight. Research suggests that IVF slightly increases the risk that the baby will be born early or with a low birth weight. Ovarian hyperstimulation syndrome. Use of injectable fertility drugs, such as human chorionic gonadotropin, HCG, to induce ovulation can cause ovarian hyperstimulation syndrome, in which your ovaries become swollen and painful. Symptoms typically last a week and include mild abdominal pain, bloating, nausea, vomiting and diarrhea. If you become pregnant, however, your symptoms might last several weeks. Rarely, it's possible to develop a more severe form of ovarian hyperstimulation syndrome that can also cause rapid weight gain and shortness of breath. Miscarriage. Miscarriage. Thank you for watching. Please subscribe our YouTube channel.